I'm gonna start it. Okay. Does it say it's recording for you guys?
Yeah.
Okay. Oh, sorry. I'm Renee.
I'm Peyton.
I'm Sam.
I'm Kiara, and we are doing a pregnancy program for our social issues group project. We are going to move through our slides very quickly, and there is a lot of information on each slide. So if you would like to read all the information that we have in here, I would suggest you pause during some aspects of our presentation.
So the first trimester starts on the first day of your last menstrual cycle and lasts for 12 weeks. Next slide. During this time, there's a lot of growth in the baby. You get the heart, the brain, the spinal cord. By the end of the first trimester, the baby has eyes, a nose, and lips. And by week 11, it's officially a fetus. On the right, there's a lot of great resources for nutrition and then help if you need financial assistance. Next slide. An important part of the first trimester is nutrition, and so you need increased vitamins and minerals. The USDA My Plate program will help with that, and your doctor with that. You have to limit sugars and refrain from drinking alcohol, and you'll need more water than usual. Next slide, please. To promote health, you need to exercise. Get 2 hours and 30 minutes of moderate level exercise per week. It's helpful if these are low impact, and you need to stay away from anything that could hurt your abdomen. On the left is a list of symptoms that you may experience, and they're all normal. And you will probably need to go to bed earlier and eat more smaller meals more frequently. And it's all normal. Sharing the news with your loved ones is completely up to you when you do that. Most people will wait till week 13 so that the possibility of having a miscarriage has been reduced, but it's up to you. During your first doctor's visit, you'll expect a lot of tests. They'll calculate your due date, and then the doctor will ask you a lot of questions about your lifestyle.
Okay, so the second trimester is classified as weeks 12 to 28. Next slide, please. So during this trimester, a lot of things happen. Your baby is going to grow a lot. You're able to distinguish their gender through ultrasound, and their movements can be felt. So the mom might feel some kicking in her belly, and also her waistline will probably thicken, so you can actually see the little pregnant belly. Next slide. So many parents are unsure whether they want to know the gender of their baby before it's born, and either of these options is 100% valid. Some people choose not to find out before they're born because they don't want gender stereotyped toys and clothes, while other couples may decide to know beforehand so that they can pick out baby names and things like that. Everyone should make this decision for themselves. Stress during the second trimester is very important because the International Journal of Stress Management tells us that a lot of complications with pregnancy can occur with stress, such as miscarriage or stillbirth or breastfeeding problems or things like that. But we can use relaxation techniques to decrease the stress during this trimester, such as breathing techniques, relaxation, and guided imagery and things like that. Next slide.
And then next we have the third trimester. So this is classified as week 28 to the birth. So the third trimester is a time of excitement as well as anxiousness as you wait for the baby to exit the body. So it's important to realize all the accomplishments of your body through your entire pregnancy, as well as knowing that you're almost at the end. So during this time, you will probably feel a lot more movement from the baby, and you'll probably be a lot more uncomfortable and have things like Braxton Hicks, which are irregular contractions, backaches, heartburn, etc. So what can you do? Make sure that you have a balanced diet and continue having those healthy lifestyle choices. And before, we recommend taking a childbirth class so that you feel prepared and less anxious for your baby's arrival. And at that class, we recommend having someone who will be with you during your birth, so that they know what's going on too. Also, packing a bag so that you're ready to go wherever you have your birth, and then also practice newborn care, understand medical interventions, and the signs of labor. You'll probably have a prenatal checkup as well. So this will go over normal things like weight and blood pressure checks, as well as vaccinations or screenings for conditions that your baby might have. So labor and delivery. This is a time where your baby will be in the lower pelvis. You'll probably feel strong contractions, cramping, back pain, and water breaking. And there's 3 stages of labor. So the first one begins when your cervix is dilated 8 to 10 centimeters. The second one is when you are pushing and delivering your baby. And then the third one is when you are delivering the placenta.
All right, and this is all about chromosomal abnormalities. So what is a chromosomal difficulty or abnormality? It's basically when there's an error occurring in the cell dividing process. Sometimes this can happen during meiosis or mitosis, and then rarely, but it happens, is if the mother exposes the fetus to teratogens while she's pregnant. And who's at risk? So mothers who are 35 and older, they are the highest women to be at risk, other than mothers using drugs or alcohol during their pregnancy, just because their eggs are getting a lot older as they age, and it becomes a less inhabitable environment for their baby. And these are the types of chromosomal abnormalities, and there's a lot of them. A lot of them we all know, like Down syndrome, which cells contain 3 copies of the 21st chromosome. Other times there's deletion, which there's a part of a chromosome that's missing from the DNA code. And then, yeah, other times there's just a bunch of other ones that will end up repeating themselves, and then you don't really know about it sometimes until after the baby's born, or even it affects them later in life. And these are some more of them. Most people don't know that hemophilia or like cystic fibrosis, those are all types of chromosomal abnormalities as well. Can go on. And for teratogen awareness. So what are teratogens? So those are just factors which cause malformation of an embryo. And then some types of them are nicotine, alcohol, retinoic acid, or rubella. And then effects of teratogens, some of them could be low birth weight, birth defects, preterm delivery, learning or behavioral problems later on in life, or even possibly death. And then this is the stages of effects of teratogens on the fetus while it is still inside the mother. And then it kind of just shows when the mother is surrounded by these teratogens, the effects it does to the specific parts of the embryo while it's growing. Thank you.
Thank you.
Yeah.
And then these are our references.